All right, well, tonight we're getting our first look inside a Detroit hospital struggling to handle the rush of coronavirus patients.
This is the front line right now at Sinai-Grace on the city's west side. Sean Lay spoke with a nurse there. Sean, we've seen a number of social media posts from nurses in the last 24 hours. They're nervous, they're exhausted, and they're very frightened.
And here at Sinai-Grace, RNs, and more than just one, I've been hearing from several all day long, are sounding the alarm right now, and they say they cannot sound that alarm more loudly enough. Look, they say at this facility, it's overrun. They're in a coronavirus crisis, this according to the nurses. They say not only do they need much more staffing, but they even need more pay so they can pick up more shifts and then try to save more lives.
You'll walk in the building, you'll walk on some of the floors, you'll see gowns hanging up on the doors because the people are reusing the gowns. You'll see gloves and masks in the hallways on the tables. You might hear call lights going off because, people need to be serviced. Yeah, it's madness.
Video from inside a regular patient floor at Sinai-Grace Hospital. Gowns hanging on doors, trash, dirty floors. Housekeeping not allowed inside rooms, we're told, to reduce coronavirus risk. Exhausted nurses telling us they are expected to do it all. As nurses say, a tidal wave of sick people have overwhelmed every area of this facility.
And the people are really sick.
Some are so sick, she says, they are dying before their coronavirus test even comes back. She also says she has to speak up for her patients. Some are waiting on test results and are sharing rooms with people who have coronavirus.
If you have a patient that has corona that's 40 years old, and then a patient that don't have corona that's 80, this 80-year-old patient don't have a chance at life because now, we infected each other due to the hospital policy or whoever approved of this. This is ridiculous.
This nurse says she signed up to help people who are suffering, but her family did not. Her biggest fear right now?
My biggest worry is catching this virus and taking it home to my family. If it was just me, I don't care. I'll come in here every day and take care of all these people. But when you have children, small children, you have infants. I have a child that's not even 1 year old, and I have a 1-year-old.
A 1-year-old at home. She does not want to take coronavirus home after her shifts here. Look, we asked the DMC about all of these concerns all these nurses are bringing to us. They just got back to us as we got on the air, saying in part DMC hospitals have been slammed by COVID-19. In part, they're saying we are using all available space in our hospitals to care for patients. We have converted operating rooms, outpatient areas, and recovery rooms into patient treatment areas to handle the surge. We are working on ways to mitigate capacity issues by moving patients from hospital to hospital within our system. Big issue here, guys. Back to you.
Well, Sean, one of the most frightening things about this whole ordeal has been the number of healthcare workers who have come down with the virus. Talk about the situation there at Sinai-Grace.
Yeah, because you don't want to lose that staff member who is caring for these individual coronavirus patients. Here, RNs are telling me that they are terrified of picking up the virus, and one already is at home. He is at home recovering, but his wife now also testing positive, and their baby. So that's exactly what they don't want, and he's not here working.
Exactly right. A double whammy on that front. We wish them the very best as well. All right, Sean.
It's awful.
Yeah.
A Detroit Democrat is the